Hello and welcome to this virtual event hosted by the Atlantic Council's Middle East programs. I'm Kirsten, Director of the Scowcroft Middle East Security Initiative at the Atlantic Council. We're delighted you could join us today for this discussion. Today's topic is at the forefront of everyone's minds: how to vaccinate entire populations against COVID-19 and quickly. Vaccination on this scale has proven a huge challenge at every stage, from testing and authorization of new research to the logistics puzzle of transporting and storing doses at sub-zero temperatures, to the final mile of putting needles into arms, not to mention public messaging and communications around all of these steps while maintaining public confidence and calm. We have watched countries struggle with many parts of this process, but we're lucky to have with us today 3 experts from countries who have risen to this challenge better than most. Since late December, the world has watched intently as the numbers of doses administered climbed rapidly in Israel, the UAE, and Bahrain. That's not to say each has not encountered its own challenges, which we'll also talk about today. But we hope to glean some lessons learned from their experiences that can be applied around the world and even in future public health crises. To briefly introduce our speakers, we are delighted to be joined by Dr. Farida Al-Hossani, spokesperson for the UAE health sector and manager of the Communicable Diseases Department at the Abu Dhabi Public Health Center. Dr. Farida is an expert in public health, communicable diseases, infectious disease, health management, leadership, innovation, medical research, and epidemiology, all of which are extremely relevant in this conversation. Dr. Farida is one of the leading voices in the UAE for communicating COVID-19 efforts and developments. We're also joined by Dr. Manaf Al-Qahtani, a key member of the Bahrain National Task Force for combating coronavirus. Dr. Al-Qahtani can often be found briefing the Bahraini media and public on the status of Bahrain's efforts against COVID-19. At the same time, he is an internist in infectious disease and a medical microbiology consultant at the Royal Medical Services of the Bahrain Defense Forces. He was previously vice president of the Bahrain Medical Society and president of the Commission Disciplining Physicians at the National Health Regulatory Authority, an appointed position. Finally, we're joined by Dr. Shoshi Goldberg. She is the chief national nurse for Israel at the Israeli Minister of Health. In this role, she oversees all nurses in the country, more than 17,000, including their licensing, establishing standards for performance, and training. She is currently also responsible for all human resources in the country related to the coronavirus and oversees the preparation of all staff who deliver vaccinations. Prior to this, she was the chief nurse of the largest medical center in Israel and was previously both an academic and a member of the Army. Lastly, we are delighted to have Jonathan Ferziger, our own Atlantic Council Senior Fellow based in Jerusalem, to moderate the conversation with our speakers. Jonathan is a veteran foreign correspondent, having served for 2 decades as the senior political reporter for Bloomberg News on Israeli and Palestinian affairs. Earlier, he worked for United Press International, reporting on the 1991 Gulf War from Saudi Arabia, leading coverage of the Oslo peace process as Jerusalem bureau chief, and serving in Hong Kong as Asia regional editor during the territory's handover from British to Chinese rule. Before I turn the program over to Jonathan, I want to remind everyone to submit your questions via the Q&A box at the bottom of your screen throughout the event, as we have reserved time for questions after the moderated discussion. If you're watching with one of our live streams on YouTube or Twitter, we welcome you to tweet your questions to us using the hashtag ACMidEast. Lastly, if you're craving more content on this topic, our moderator, Jonathan, has just published an excellent article that explores some of the factors that allowed these Abraham Accord countries to jumpstart their vaccination drives. You can find Jonathan's article in the Zoom chat panel momentarily when my colleague Catherine Worth places it there for all of us to see. So Jonathan, please take it away.
Kirsten, thank you very much. And it's great to see you, Dr. Al-Hossani, Dr. Al-Qahtani, and Dr. Goldberg. So let's start with our discussion. First question is, I'm going to ask each of you, starting with Dr. Goldberg, can you describe for us Israel's experience with the vaccine rollout? What were the key priorities in planning for the many stages involved in testing and approval and acquisition, distribution, and of course, administration.
Okay, thank you, Jonathan, and hello, everybody. Israel's successful vaccine drive can be attributed to several factors. The first one is leadership. The vaccine drive is managed in a national level, where the Ministry of Health and above it, from the Prime Minister and all the political leadership in the country, they are leading the national vaccine. It's not something that is led by the HMOs or by the hospitals, but it's something that we put the priorities to it, and we decide how many vaccines, who is going to get them, in what time they are going to get them. So this one is I think the leadership is the main issue that we can talk about. The second one is that we have 4 HMOs that are with a very well established computerized and logistical systems, which can trace all their clients, invite them on an individual basis to get the vaccine, and really can control and centralize all the vaccination plan. They know their population in the community. They are spread all over the country. So they are the best thing that happened to us when we had to give a national vaccination to all the people in the country. The second thing was that people were desire to know how to get out of this corona disease, to go back to their life. So they wanted to get the vaccine, and they were waiting for the opportunity to get it and to be vaccinated. We had a very huge vaccine campaign that helped us to bring the people into the stations where we gave the vaccines. The green passport, a way to another optimistic way to look at the opportunity to go out from this situation and go back to a lot of things that during this year we didn't make. To go to a restaurant, to drink coffee with friends, to see a movie, and a lot of things that people waited for this green passport. I'm not speaking about going abroad and visiting to some other places. All the issue is very managed and monitored. We know we have a lot of dashboard. We know in every minute how many people are vaccinated, where the vaccinations are, how many staff we have now, what are the qualification of the staff that we are using. And I think that if I want to summarize it, so I can say it's the leadership, it's the HMOs, it's the campaign that we had, it's the green passport, and it's the management and the monitoring of all the procedure. Thank you, Jonathan.
Dr. Goldberg, thank you very much. I think the centralization of the computerized health data is something that's been fascinating to the whole world, and we'll get back to that. So let's go from Jerusalem to Abu Dhabi, and Dr. Al-Husani, again, if you could set the stage for us, what has been the UAE's experience with the vaccine rollout, particular to your country?
Greetings from United Arab Emirates. Really, I do agree with Dr. Goldberg regarding the important key success factors that she mentioned. And I think the first thing is the leadership commitment and engagement in every stages of the vaccination, including the preparation even before the vaccination campaign. Our leadership at the highest level of strategic leadership participated in being a role model travel and getting the vaccine early on, and this helped and supported the engagement of different community members of our society. Also, the alignment and the coordination between different stakeholders. This include the health stakeholders, definitely, but also in addition to the health, other organizations, including public and private sector, their engagement in the campaign and support of certain policies, and giving incentives for employees to get vaccinated and participating in the awareness and education of the different staff and family members have been really creating a key factor of success here in UAE. I would like to add as well that the flexibility to adapt to new changes is required with COVID vaccination. So updating, expediting the process of registration, of evaluation, of assessment, and getting the results out of the stage 3 study. All of this have been really very helping to ensure that we reach the highest level of coverage for our community in a shortest possible time. In addition, we also launched a very big campaign to educate the public, to make them aware of the vaccines, providing the knowledge and information, answering their question, trying to tackle the myths around the vaccines that are coming through different social media platforms. I think those are major things, and also emphasis on the infrastructure of healthcare system. We have been really rolling out the vaccine in our public and private network of providers, and all of them are connected to electronic medical record. So we are able to monitor and assess different indicators over time. On daily basis, we are seeing the good progress. We are tackling any challenges that we see. So the technology and the innovation definitely is one of the enablers, main enablers of the success of the vaccination in United Arab Emirates, and definitely the continuous research and the role of the science since we started the participation of a clinical stage 3 study in the vaccination, we could see the engagement of the community. So they were prepared for the next stage. We conducted a couple of surveys to see the acceptance of the community, and based on this, we rolled out the campaign. We could see that even the level of acceptance from the beginning was good and higher than expected. So all of those factors really participated in the success of the experience of COVID vaccination in United Arab Emirates.
Dr. Hassani, thank you very much. We're going to move up the Gulf Coast to Manama and Dr. Al-Khattani. I want to ask you a similar question, but particular to Bahrain. What have been the challenges in rolling out the logistics to the vaccination campaign?
Thank you, Jonathan. It's great to be here. And this is what we have learned from COVID-19 is the unity of the humanity across the world and sharing the experience and the knowledge. You know, Bahrain is around 1.5 million, so it's a small country, but it's very well known for the outstanding achievement of its own people. So I do remember vividly, it has been almost a year now from fighting this COVID-19. So even before we had the first case, which was February 23rd, 2020, we actually asked three vital questions. What happened if we had one case, and that one case can lead into 100 of cases? And we all know from day one, testing, treating, and isolating would be the main strategy in combating. And this is even before you heard about the vaccination. But we knew from the moment, like once we reached the vaccine, which that was a science breakthrough. We never imagined we're going to have a vaccine within the pandemic. So I think we should give a thumbs up for all the scientists that have put all their effort in manufacturing a wonderful different platform of the vaccine. So vaccination is the only way to end this pandemic and actually to save lives. So we started back in July. We actually had 3 stages of vaccination program in Bahrain. First of all, we want to set the scene about vaccination. Now, vaccine is something that Bahrain was very well known in high record in acceptance of the community. But you're talking about a truly new vaccine against this emerging new virus. So we have done that by doing the trial in collaboration with G42, which is the United Arab Emirates, again, to test the efficacy and to test the acceptance of the community. And we were so surprised that we've got 7,500 participant within 6 weeks from enrollment. So that was a kind of a thumbs up about the acceptance. Then we went to the stage 2, which is testing in a semi-real life enrollment of the vaccination. So this is the EUA, emergency under authorization. We have vaccinated around 4,000 of a targeted group. And again, we have tested the acceptance, the safety, we have monitored the side effect before our big day in December 16, where we have announced our nationwide vaccination program. We aimed to vaccinate 1.1 million of the Bahrain population. So we are 1.4, 1.5 million. And you know, Jonathan, it's so easy to find the first tier, which is the high risk category, the frontliner, but then you're gonna go into the dark zone, who's gonna be the next category and how you're gonna categorize them. And this is where we have decided by His Majesty that we're gonna really vaccinate anyone above age of 18 and above. And that actually put us into one of the challenges in trying to secure the number of vials here in the country. And as you know, the whole world has been suffering from short supply from the vaccine. But I think one of the lessons that we have learned earlier on is securing the number of vials really at the beginning of the pandemic. So starting from June, July, we started to approach the manufacturer. And the first one was the Sinopharm. This is where we have expressed our interest to try one of the very familiar inactivated vaccine that we have so many years of experience, and then we have approached different manufacturers. So we have secured good amount of vaccine earlier on. We knew you're going to have in a short-term supply. Bahrain, unfortunately, does not have the capacity to manufacture vaccines, so we are depending on other countries or organization in providing the vaccine. So we have done that. We have enrolled the trial, and that have secured certain amount of the vaccine for our population. But then we have signed the contract with so many other manufacturers. We have studied different variety, Jonathan, of the platform. Being an infectious disease, we knew this virus is going to mutate and they're going to have new variants. So depending on one type of platform, maybe it's a good idea, maybe it's not a good idea. It all depends on what would be the mutation. Luckily enough, with any traditional inactivated, it's the one that produce polyclonal antibodies. So you're going to cover the majority of the antibodies. Luckily enough, with different platforms have shown that they're also efficacious against the variant. But the strategy of having a variety of platforms, it will minimize the escape immune response from the variant, and I think that's a key thing. Registering, approaching the manufacturer earlier on, having a trial in the country, I think those have boosted the ease, the comfort of the Bahrain population. We have seen the result. We have seen the outcome of the vaccination. The social media, as you know, has so negative impact on the uptake of the vaccination. So what would be the best way to ease off the pressure in your own society is actually when you share and you become transparent, the own data. And that's what we did. We shared the data from the trial and from the emergency use authorization. So the people behind felt very comfortable. We were quite open with them with all the side effects. We tell them that they're going to be close monitoring and the side effect. And the beauty of all of this, Jonathan, the vaccine has been free for the whole residents of Bahrain. And I think that's a very key thing when you talk about equity, when you talk about how can you make sure that everyone going to get the vaccine. And I think the government of Bahrain take that efforts and saying the vaccine going to be for free. If you are above age of 18, come on, register, come along, and we're going to vaccinate you. I think that has been a truly wonderful an example of where you have to provide all the support during a pandemic. COVID-19, there are so many lessons that we have learned in this country. Besides, you have to be very patient. And I think a year from this pandemic tell us, yes, you have to be very patient, but again, you have to be collaborative, you have to be open-minded, you have to listen to your community, you have to work with them and how to accept it. And I think those would be kind of the journey of vaccination in Kingdom of Bahrain.
Thank you, Dr. Al-Qahtani. And we're back in Jerusalem. Dr. Goldberg, there has been a great deal of fascination on how it was that Israel jumped out in front and made a deal with Pfizer to collect and deliver all the information from the 4 HMOs to help get a sense of how the vaccinations were working. I think Prime Minister Netanyahu made a splash in Davos in describing it last week. But can you explain how it was and why that Israel reached this agreement with Pfizer and what we're learning so far from the data?
Okay, Jonathan, you know, I don't know how exactly was the agreement between the Prime Minister and the Pfizer company, but I really am very thankful for that. I can tell you that from the moment we knew that we are going to get those vaccines, we knew that we are going to vaccinate we wish to vaccinate all the population in the country, but we are not getting the full amount of vaccination that we need. So we had to prioritize it. And we decided to start and give it to the people who are mostly at risk. So we started with the very old people under over the age of 16 and with the medical staff. I can tell you that when we just received the vaccines, we were in a situation that we had more than 6,000 member staffs, nurses, physicians, and others that were out of work because of the COVID-19. They were or isolated or sick with the COVID. So it was really a hope that we got, and a huge opportunity to go over the COVID-19. We're still, you know, struggling the disease. We are not in the end of it. But when we get the option to get those vaccines, we, as the clinical staff, we were in touch with Pfizer company. We learned from them how to use the vaccine, how to deliver it, what are the main logistical obstacles that were the main issues, because we know how to vaccinate, but we didn't have we didn't know how to move it from one way to another, or how to cut the vaccination trials, how to get to the end point where all over the country, where we had the citizens that we wanted to go to them. So I don't know what was the political issues in this, decision-making process. But I know that we feel very lucky and very committed and responsible to use it the best way that we can. And we are really doing our best to do it now.
Thank you. Thank you, Dr. Goldberg. Let's go to Dr. Al-Husani again. The UAE has emerged as a regional hub for vaccine logistics through the HOPE Consortium, and just recently as announced as a center for vaccine production as well, in partnership with Sinopharm. How are cooperation and vaccine diplomacy, if you will, playing a role in the UAE public health strategy, whether it's part of the new Abraham Accords or with global powers like China?
Well, I think definitely both goes hand in hand together because UAE have always put the human being in the top priority as a government of all strategic priorities. So securing the earliest possible vaccine shipment to our population has been one of the top priorities through discussions with different vaccine manufacturers, also starting and participating with the global community to conduct the clinical trial in the vaccination. We had the advantage that UAE had a multinational community that can help adding this study or including UAE in this clinical trial could add a big value to the whole world. So this is where we started, but also UAE, as you know, have been working in the whole COVID experience to provide aid and support for different countries through the international collaboration. So definitely we are engaged in the discussion of how we can work with other countries to support the access, the logistics parts of the vaccines to other countries. We do have a very strong infrastructure when it comes to international flights, to also storage. We are already a regional hub for many pharmaceutical vaccines for the commercial use and for international aids as well. So definitely the leadership support has been trying to work out a balance between ensuring the availability of the vaccine for our society, but also working with the international community to ensure the availability of the vaccine to other countries in the world.
Thank you, Dr. Al-Hassani. In Bahrain, Dr. Al-Khattani, the kingdom recently approved a third vaccine for use in Bahrain, the Oxford AstraZeneca vaccine. How do you expect this to impact Bahrain's already positive trajectory with the vaccinations? What is Bahrain's overall timeline for the vaccinations?
All right, Jonathan, I think Bahrain is blessed by two major factors. So they have an excellent diplomatic relationship with the world. And I think that relationship has enabled Bahrain to secure enough supply of the vaccination for the people who live in this land. Secondly, it's the eagerness, it's the acceptance of our society and the trust that they have towards the National Task Force team. I think the transparency, working together, putting the plan together, engaging them all the way through the COVID-19, that had just made the road for us such an easy process. There has been some obstacle definitely when it comes for meeting the demand. But as my colleagues have said, with any vaccine, Jonathan, you need to get the things roll in, as they say, get the arms, get the injection, and not just to keep them on the shelf. And with the diversity of the vaccines platforms and with the logistic, we had to kind of train our personnel on how to deal with the logistics, especially with certain manufacturers like the messenger, and without having any additional waste. I can tell you for sure that from the Pfizer, we have vaccinated almost from our stock nearly 35% with zero waste. We have also vaccinated with the inactivated more than 45%, again, without any wastage. And now with the AstraZeneca, and AstraZeneca, this is the one from the Serum Institute of India. Again, we have been, I think that was a truly diplomatic relationship between the kingdom and India. We have a very strong relationship with India. We are very well known to kind of host and welcome the Indian citizen here in Bahrain. We have been provided all the care they want for free. We have waived all the medical costs for them, including medical treatment for COVID or even non-COVID during this pandemic. I think that was a very successful leadership thinking in this kingdom, where you become the giver, and now you're becoming the takers when it comes from the vaccine. So I think it's the leadership, it's the community engagement, and of course it's thinking ahead of time, where you have to kind of think what's going to be the best for your community.
Thank you, Doctor. Now, let me ask the three of you, and I'm going to start with Dr. Al-Hossani in the UAE. Is it just a coincidence that Israel, the UAE, and Bahrain became partners last year to the Abraham Accords, and your three countries are now leading the world in the battle on COVID-19? Has there been any collaboration or joint discussion of the pandemic? And what do you see as the future of cooperation on medical issues between your three countries? Dr. Al-Hossani.
Thank you, and this is very important question. Actually, as you rightly said, that the health diplomacy plays a major role in enabling the local health policies as well. We have been working very closely with Bahrain. We consider ourselves one team from the technical and from the political side of the vaccine experience. We have been working closely with our colleagues in Bahrain in the preparations in the clinical trial. They have been participating with us in the clinical trial phase 3 for Sinopharm vaccine. So definitely it helps a lot to exchange knowledge and experience with your colleagues in other countries. It enriched the knowledge within especially that we are in the vaccine, COVID vaccine in the world. It's a totally new experience for all of us. So definitely the engagement with the international communities, including Bahrain and Israel, has been really very useful to help us to have a better understanding of others' experience, sharing knowledge and experience from UAE side as well. We have also having multiple discussions with our colleagues in Jerusalem to see how much we can work together to learn from each other's experiences, what are the strength points that each country have, and how we can avoid some of the challenges or overcome those challenges. So yes, we are working closely by all means, and UAE is always have been open for regional and for international collaboration in all aspects, but also in health specifically. We believe that working closely as international society will help us to have a better understanding of COVID and to expedite the research and science and help us to have a better control of the disease.
Dr. Al-Hossani, thank you very much. You know, it really is very early in this relationship between your three countries. The Abraham Accords were just signed in September. And then to have this happen in the middle of the pandemic is extraordinary. But I know that there's been a contact and help among all of you. Dr. Al-Hossani, what can you tell me about medical cooperation through the last couple of months?
Sure. Jonathan, I think, as I said, there are so many learning lessons from the COVID-19, but I do hope you agree with me in this point. When it comes for COVID-19, the virus itself, the big lesson I have learned myself, this virus does not discriminate between ethnicity, the origin of the country, or even your belief. This virus, if you don't contain it in one of the countries, it's going to spread and across the globe. So one thing that I have learned is collaboration between the countries, and the open-minded thinking to stop this pandemic is a key thing that the nationwide has to learn from COVID-19. We really have to forget everything except it's the safety and the health of the well-being of the humanity. And this will come through the collaboration and the international open-minded thinking. And as Dr. Farida was saying, I was very blessed to work with a fantastic group in the UAE, to be honest. The trial has been something, first thing here in Bahrain, but it has been a learning curve for us. even the Chinese government has been labeling us as the expert in trial now in the Kingdom of Bahrain. But it's again, it's how you learn from your weakness and how to learn from other countries. Bahrain has shared their knowledge in combating this virus with many different countries. In Mexico, in UK as well, we had so many international collaboration. And I think even the WHO statement back in March, and that has been really something I feel very proud to be a citizen of Bahrain, that Bahrain should be taken as an example to be led in combating the coronavirus. And all of this because of the transparency, is the international collaboration and the excellent diplomatic relationship with the rest of the world.
Thank you, Dr. Al-Qahtani. Dr. Goldberg, perhaps you can talk about, and again, this is early on in relations between the three countries. I think Prime Minister Netanyahu is planning to go to the UAE next week, but it's been canceled, it's suspended 2 or 3 times, so who knows. Let me ask you about the prospects for future cooperation with the UAE and Bahrain and other Arab states over the next months and years. What do you see?
Okay, thank you. First of all, I have to say that I think that this conversation is amazing, because we can see that we are dealing with the same issues and with the same solutions, and we are really having the same goals. And even if we are doing it in a different way, each one of us, but at the end, we are doing the same things. And we can learn from each other, and we are learning from each other. We agreed here that we need leadership and transparency all over the way of giving this vaccine and dealing with the COVID-19. As I heard my colleagues before, the COVID-19 is a huge international problem. It's not a one country's problems. It goes between us, between all over the countries. And we have to work together. It's a clinical issue. It's the health of our citizens, of our children, of our families. We see that we think that we are going over the virus, but we have it in a new way of other mutations every new day. We see that in our country, that the lockout that we have done now for 27 days, it's not enough, because we are not succeeding to go over this, the spread of the virus. So we need the collaboration. It's not a political issue by itself. It's a really clinical issue. So as we will go on, be between countries more transparent, we will work more together. We will share our knowledge and our experience. We will see that we are very similar, but we always can learn from someone else and not do the same mistakes. And just together, we can deal with this virus. I feel that now is strongest than us, and we need this collaboration in order to go over it. So I want to stay very optimistic and have some faith that the world will going to change. There will be more collaboration between countries during the coming years. Something good that the COVID-19 will leave us in all of the world. Thank you.
Okay, thank you, Dr. Goldberg. We are going to go to questions from the audience. We have a very large audience around the world. And this first question comes from Stephen Kalin. He says, I'd love to hear the speakers discuss the different ways that they've balanced public health with economic opening, seeing how Israel has gone through several cycles of lockdown and reopening, while Dubai has stayed very open and Abu Dhabi has been more cautious. If you could talk, Dr. Al-Husani, for starters, what are the trade-offs and the calculations that have been made between the danger of the pandemic and infection and the need to keep the economy moving?
Thank you for this question, and it's really a learning experience that we are all passing through the world to reach this kind of the balance between how to prioritize or how to maintain population's health and wellness, in the same time maintain the economy as it's a vital to the sustainability of different countries as well. So this is definitely a very challenging formula. However, I think that the one thing that we agree all in is that vaccination definitely helps to revive the economy back and helps to, we are aiming to reach a level of herd immunity through vaccination. And this will definitely have to support positively in our economy as well. So the more we vaccinate, the more we are able to go back to the normal life, to normal businesses and reopen tourism. Therefore, this is a common agenda that we have at the international level and at the local level. We have been also working very closely at the national level in United Arab Emirates to ensure that the public health standards and protocols are adhered to and are always updated up to the best standards that we have, and also updated based on the new researches and knowledge that are coming recently, whether it's related to practices related to quarantine or isolation. And as you know, UAE overall strategic approach to COVID-19 have been very unique with the focus on expanding testing and early detection and early interventions. And I believe that this experience have really brought up results to show that we passed through a very I could say stable stages of COVID through most of the last year, and hopefully this will also bring some decline in the number of the cases for this year. So definitely the balance is very important, and adapting the best international standards when it comes to public health measures is also important. I see that international standards is very well different from countries to countries, but we are always following the international practices, and we are really trying to learn from other countries' strength and success experiences as well.
Dr. Goldberg, maybe you can talk about Israel's experience with that balance of Israel has gone through several lockdowns. The airport is closed right now, and people are very worried about what this is doing to the economy.
And they're right, I think, because it's a really long time that we are dealing with, it's quite a long time that we are dealing with the COVID-19. As Dr. Farida said before, there is no one solution. We are struggling the ways to go over it. And I think there are a lot of occupations during this year that were really armed and couldn't open their business and couldn't go back to work and lost their jobs. And it will be a great challenge after we will finish the COVID-19 to go over it in the coming months or coming years even. You know, the government is trying to give solutions. They have in one hand, they have the one thing that we know that succeed, the lockdown and closing the system, closing the educational system, looking at the experience of all over the world. And the other end is trying to help and give a budget to help those businesses that couldn't open and couldn't go back to the real life. I agree that the vaccination and the green passport, we hope at least, are going to get us away, but it will be an issue for the coming months also. And we don't have one right solution to say that we can recommend on. It's really a lot of struggling between opening the country, opening the airport, and in the other end, you know, dealing with the COVID-19 disease that is spreading all over around with those mutations. Thank you.
Okay. Thank you very much, Dr. Goldberg. Here is a question directly for Dr. Al-Qahtani on Bahrain from Sandeep Singh Grewal. Number one, can you elaborate on the challenge to convince residents and citizens to take the jab due to several speculative theories and reports circulating? Number two, are there plans to import additional doses in the coming months? And three, will trial volunteers who got the placebo get the real shots? And do you plan to lower the age from 18 to 16 to get the vaccine in the future? Those are the questions.
If you don't mind, Jonathan, if I just take also part from the previous questions when you talked about how the other countries has balance between the economy and the coronavirus. I think we have done it differently here in Bahrain. I think, Jonathan, we have never locked down the country. We have never shut down the airport. Even for the school, we have just temporarily shut it down. And earlier on, this is where we have, again, learning about the coronavirus and see the effect on children. So the life has continued here in Bahrain, but with restriction and with measures. So we never had a lockdown. We never had shutting down the borders, and we never had closing even the airport since the early on of the pandemic. Now, what was the reason behind that? It's basically one principle, Jonathan, that again, we really need to know and learn our lesson from this pandemic. It's the behavior of the virus linked to the behavior of individual. And I think that was the key thing. Being applying the principle of the precautionary measures, universal masking, that was the key thing in this country. We never had a problem in universal masking. We never had a problem in mandating that. And in the initial phase, there was no legitimate law that can reinforce masking. Everyone put the mask by themselves. To the point where we had to put some more law enforcement for those minority that they just, doesn't want to listen about the effect of universal masking. But even for the school, we had an optional for the parents, whether you want to go online or go to school. So it's basically the economy is very important to be running along with the pandemic. But the most important thing, Jonathan, it's the psychological and the well-being of the human being. I do believe lockdown is a temporary solution to find us sometimes. What we did here in Bahrain, even before, and lockdown, we're going to be really beneficial when you're reaching the limit, over limit capacity in your medical facility. Where we had initially have thought of all of this, we have created 22 centers for COVID-19. You're talking about 9,000 beds. Again, just to remind you, we're only 1.5 million. So we really created a separate pathway for COVID, completely separate than the non-COVID. So we never had any problem with the medical facility. We never shut down any medical care. Emergency elective procedure has been going on along with the pandemic. This is the early planning. This is where you need to know where you're going to keep those patients. And again, earlier on the pandemic, we learned about the clinical features of coronavirus. We had to admit every single person to know that by day 5, day 10, those people might deteriorate. And this is where we have implemented the policy for home isolation, etc. So it's just early planning, thinking ahead of the virus. You can still maintain your economy in a legitimate way along with the pandemic. I just want to kind of give you a cross brief on the first part. Going back to the questions, I think the first question is securing vaccine, right? That was the first part.
Specific to Bahrain.
Yes. So again, as I said, I think the question was convincing the people. Yes. So the one way we have done it successfully is by having, as I said, the trial. The trial was something for the first time in Bahrain to be done. And we're talking about the vaccine trial. This is the first randomized control trial in the Kingdom of Bahrain. So the people who enter the trial are the people who lives in Bahrain. So they have seen the process, they have seen the side effect, they have seen the safety, and it's tolerable. So all this nonsense of the side effect of the vaccine that you can walk backward, and all of this nonsense. People have said this is nonsense, and they have seen the dramatic effect of the complication of getting the virus. And certainly we have seen those who get the virus, the complication of it is far beyond the complication of the vaccine. So that's number one. Number two, regarding, I think, the age, when we're going to limit the age. So again, we just went to the rules. So Sinopharm in the trial, we enrolled 15. Right now, we're doing the trial to include those who are less than 18. So I was told by late February, early March, we're going to have the result. Again, I have confidence it will be safe. But once we have the safety profile on children, then we're going to say for those less than 18, come on along and we're going to get vaccinated. And I think the volunteers, that was the most difficult questions, to be honest, Jonathan, when it comes from the ethical point of view. Maybe Farida knows, I've been a very big advocate from the volunteer side. As you know, in any clinical trial, you really have to oblige with a 1-year follow-up. And again, this is something that we know as a trial. What's the difference here, Jonathan? We are running the trial in the middle of the pandemic. So ethically is not acceptable to continue letting the volunteers being unblinded. So what we have done in approaching, and I think Pfizer have done the same, is actually we approach the volunteers and we tell them that, you know what, we thank you for being participant. You're participating. It's really vital to ensure the safety profile in 1 year, but you have the choice. If you have a high risk factor or you are one of the frontliner, then you can be unblinded and you can be out of the trial. So we give them the option, and some of them in Bahrain wanted to continue on the trial, and again, the key thing here, vaccination is not the only way that's gonna protect you 100%. Even with the vaccination, you still need to wear the mask, you still need to keep distance. So I think when the people learned, the volunteers, when they learned that vaccination is not the only solution, I think they accepted that, okay, I'm going to continue to be on the trial and I'm going to take the mask. But for those who have the risk factor or the age above 50, we actually offer them to be off the trial and give them the vaccine.
Okay, Dr. Al-Qahtani, I think that's a lesson that everybody in all 3 countries can learn. This question for Dr. Al-Hassani comes from Amir Al-Saman. Interesting and challenging question. She asks, will the UAE be providing vaccines to developing countries, particularly those that are not in good standing with the international community, such as Syria and Iran?
Well, this is an important question, and I think there has been a lot of expectations from United Arab Emirates, the different stakeholders in United Arab Emirates. Our leadership position is really to provide as much as we can when it comes to support of the international community. However, as you know, we are not a vaccine manufacturer. We are building up our capacity, hopefully, for future manufacturing capabilities and for COVID vaccines as well. So the long-term strategic vision is there. For the support of the international community, we are currently having many conversations on how best UAE can support different countries, whether with the vaccine supply network, with the infrastructure, with sharing knowledge, with different means. So definitely we are willing, and our leadership vision has been always there to provide the support, and there has been many discussions so far. Hopefully we get some announcements or some tangible outcomes out of those discussions.
Okay, thank you very much. And over to Jerusalem. I have a question from Mohammed Al-Dashan, who's the Managing Director of Oxcon Frontier Markets, and my own. There's been some controversy about whether Israel is responsible for seeing that Palestinians are vaccinated. I know that about 5,000 doses are being transferred for medical workers, but Mr. Al-Dashan says, what kind of further plans may be carried out to help the Palestinians through this? And is it not seen as a risk to the health of Israeli citizens as well, because so many Palestinians are working in the economy?
So thank you for the question. I think that when you are looking at the international level of dealing with the COVID-19, we want, as everybody, that all the population all over the world will be vaccinated. Especially if you have similar borders with another country, that it can influence on delivering and spreading the COVID-19. I'm dealing more with the clinical issues, and the question is more political issue. So I'm sure that the government is negotiating and trying to find ways to, to give or to find solutions for both of the countries. We are now dealing with we don't have enough vaccines in this point of time to vaccinate all the citizens in the country. I'm sure that the Palestinians are doing the same efforts to get the vaccines to their country and to vaccinate the people there. We are sharing the educational webinars that we are doing. We are sharing the knowledge that we have. I have a webinar with them in this week even, and we are sharing all the knowledge and the information that we have. And I'm sure that there will be a political solutions to this problem. And it's an international way of looking at it. Like the WHO really talked about it a lot of times. I hope there will be enough vaccinations. Maybe I'm too optimistic, but I want to believe that in the future there will be enough vaccinations to vaccinate all the countries, not only the strong countries, but everybody that needs the vaccinations, because it's a huge international problem. Not a problem of one country and the other one, no. So I'm sure there will be in the coming future a solution to this problem also.
Okay, listen, I want to thank we're running out of time over here, and wish we could get to all the questions that have come in. There have been many. It has been fascinating to talk to all of you, to Dr. Al-Husani, Dr. Al-Qahtani, and Dr. Goldberg. I want to thank you for joining us in this international webinar. The Atlantic Council is dedicated to trying to increase communication and understanding across borders, and you really have contributed to this effort at this very trying time around the world. So thank you all, thank you to the audience, and be well, be safe.